Would you please facilitate the exit of those leaving so as to start? So, fortunately, we're reaching the last session of this first day of the conference on the main subject, which is the power of insurance in health system reform. The unlocking of the healthcare system potential. So we are to embark upon a brand new subject, and I will let you think of what this brand new thing will be, because the chamber has accustomed us to cover every aspect and every facet in the annual conferences. We will have with us Pavlina Karasiotou, the Secretary General of Fiscal Policy in the Ministry of Economy and Finance, Mr. Sarandos Efstathopoulos, who is the Governor of the Metaxa Cancer Hospital of Piraeus. Mr. Ioannis Kantoros will not attend due to a prior obligation, and we will be substituted by Mr. Veliotis, who is member of the Managing Board and President of the Health Committee in the Hellenic Insurance Company Association. We'll also have with us Mr. Athanasios Lopatatzidis, yes, he's in his seat, and Mr. Nikos Dedes. And Mr. Nikos Papadimitriou, last but not least. We usually say that when something is offered well, served well, everybody gains. In guise of brief introduction, I would like to say that the Chamber has secured a very well documented paper of what is presented in the field of products and services of the health sector. The jurists who always seek for the deficiencies state that we should not be one-faced only from the viewpoint of the offer, of services offer, but we should also take a glance of the demand, whether the offer is identical with that of demand, so as to best possible effect, the best possible result for all the stakeholders. So, who are the stakeholders? Let me start due to my capacity, because insurance may not be one of the main points of all conferences, but it is something that was lacking, and it was restituted this year. I'm extremely glad for that. So, insurance is a link between supply and offer. And demand. So it is a link that converses both with the health service providers and users. The providers include hospitals, physicians, technology companies, digital transformation, and whatever makes us proud. And indeed, we listen very interesting things on this subject today. What is it that sometimes does not suffice? That science, progress, and technology may not reach the ultimate destination, and we might feel deficiencies. We've heard of deficiencies, lacks from the previous speakers. What could the Chamber do in this last panel at the last moment so as to positively contribute in order to reduce, because it cannot annihilate, but reduce this imbalance between demand and supply? When we say demand, this is a field, a space, where real needs are detected, are developed. If these needs can be covered by offer, this is the desideratum. Many things are secured vis-à-vis the offer of services and products, but cannot reach the demand, cannot cover patients' daily needs. And this is, for me, as a jurist, I've learned, and I'm accustomed to transactions, negotiations, and satisfying all involved parties. This causes an impasse. So I start by addressing a question to the distinguished panelists. And I raised the question on whether they have in mind some good practices, any good practices from direct servicing of patients, the kind of servicing for which insurance companies are also interested, which is the new stakeholder entering the space, the market. And the question is more acutely addressed to the private sector, where negotiations are easier, and the public sector, where there are limited margins for consensual procedures for the development of the system. If we see out of this discussion that something may proceed and improve in the field of negotiations or communication, if you like, between patients and health service providers who will have contributed for the integration of insurance in the national health system. So I would please ask the Secretary General of Fiscal Policy, dear Pavlina Karasiotou, to tell us if there is any prospect to see insurance companies to cooperate with the public sector of health services. We've heard of PPPs in the field of health between public and private sector, but we also hear certain paradoxes that we will make use of data collected by the public so as to assess the effectiveness of the whole system. This has to be commented if it doesn't go against the GDPR. So I reiterate the question, Madam Karasiotou. Do you have in mind any activity or any perspective for the improvement of communication? Let us start humbly before reaching negotiations and consensus between demand and offer in health services. Well, allow me to say, first of all, to express my joy for being here today and convey my thanks to you personally and the Chamber for the invitation sent to us. Indeed, the issue of insurance companies and health sector does not appear quite often in this form in panels. So I'll speak from the viewpoint of the public health care system under my capacity as Secretary General in the Ministry of National Economy and Finance, as well as my previous capacity of Secretary General of Social Security. So I'd like to say, first of all, that the offer of health services is an extremely costly activity. For the individual, it is extremely onerous. It cannot be covered. This gap is covered by insurance at large, not only Social Security, but also private insurance wherever needed. I have been attending the discussions and deliberations of this conference from my office since the morning. We have a very fruitful dialogue on the subject of both health services offer, how one can have access to qualitative services, but within, of course, certain fiscal limits. On one hand, we have important parameters for the explosion of cost, new therapies, the aging population, prolongation of life expectancy, and so forth. On the other hand, we have tools that can help us, if not to contain the whole expenditure, but curtail it, if you like. I speak of new technologies, AI, data harnessing, and so forth. So, at this point in Greece, I would say that the public system offers universal coverage. Whoever is employed in Greece is automatically covered, has access to all services, both in the public sector, that is public hospitals, and individual and private hospitals which have co-signed with the public sector. On the other hand, unemployed persons, long-term unemployed or without even seeking job, they also have specific offers. And a basic part that I would say that is extremely promising, where we start already seeing synergies, has to do with the implementation of DRGs. Now we have shifted to a new system where the main social security organization of the country, that is AOP, has evolved over the last 15 years from a health services provider, because we all remember that there were the various outpatient offices of ICA. Now, 15 years later, it has developed into a buyer of health services. It operates, AOP operates in the framework of a public interest and securing public interest. It operates as a buyer of health services. This is a major development. Great progress. And the last thing, which is neither taken for granted or easy, the last is that DRGs in the past, the way they were developed, have been transformed into pricing on the basis of DRG, specific patterns, that is, specific models, where you can speak of pricing on the basis of effectiveness, transparency, efficiency. So, in order to launch the discussion, if you ask me what is the first aspect that we see in this field. Thank you. Now, let us ask the governor of the Metaxa Cancer Center, which is a public hospital. Let us ask him about the implementation or the eventual implementation of insurance programs in order to curtail cost, or for securing agreements between physicians, nurses, patients, and whomever would be interested.
Now, I'm very happy because we are finally opening up a subject that was untouched for a great number of years. And why was that? Is that the current government and this minister have taken down a series of taboos and stereotypes. Now, you see, the minister was very open to discussion earlier. So the time has come now to touch upon the issue of private insurance in public hospitals. So we saw that when the door opens, it opens for everyone, and the tide rises all ships. So whenever there is the partnership of the public and private sector in health, the results are spectacular. Such an example was the COVID pandemic and the afternoon or the evening surgeries that offer free surgery through the funding from the RRF and are implemented both in private and public hospitals alike. And a series of other initiatives, as mentioned by the Deputy Minister earlier, the new way in which the public hospital can now hire staff in order to cover its needs more fast and more expediently and more efficiently. Now, the DRGs will play an even more important role because we will have a clear picture as to what the hospital produces, what is the productivity of each doctor, of each clinic and everything. So having a clearer picture, we'll be able to shape our needs and to implement the interventions that are required. Now, as far as I'm personally concerned, I would say that we wouldn't be negative to such a development for an array of reasons. Now, regarding public hospitals, first of all, this would mean more revenue. This is what we're talking about. Being capable of serving more cases, because this is what we're doing it, then why not claim more revenue for public hospitals? I mean, for decades, the debate was, or rather, what the people wanted was for public hospitals to work like the private ones. This is a phrase that we don't hear repeated with the same zeal. Why? Because of late, there's a lot of steps forward in many sectors. The minister says that the national health system changes. I'm more bold. And I'm saying, living from within, that the national health system is being reinvented. Building updates. Buildings that were built in the 50s and the 60s and are updated for the next 30 years. We are experiencing a digital revolution that we will see in all its grandeur in 2026 with IT systems, with medical, with patient health records, e-personal records, hirings of staff. I mean, there were and there will always be problems. There's no magic wand that we will yield and will resolve the problems automatically. It has to do with the will, the political will, and whether we view the glass as half full or half empty. We view it as half full. And all polls, and this is important to say, all polls that have been made in the past 2 years, that the health problem used to be up in the top 3 of Greek citizens, it is constantly dwindling, it's dropping at a spectacular pace, and this says something. Now, we saw this in the evaluation. We're still not in the new system of evaluation, but we've implemented our own electronic system of evaluation and assessment. And among thousands of assessments, you know, this beautiful system with the smiles, the faces, the smiling with frowning faces, which is very easy to press when you're going out. We received a rate of something like 4.6, if I'm not wrong, out of 5. And the sample was around 1,800 people. It's not bad, says the moderator. No, says the speaker, it's not bad, but there's a lot of shortcomings, but we are optimistic. Aren't there negatives in all this discussion about introducing private insurance in public hospitals? Well, of course there will be ups and downs, the positives and the negatives. It's a matter of will. Because to me, it's not a technocratic problem. It used to be ideological. Since it stopped being ideological, if those of us who are involved in health sit around the same table with the insurance market, I feel that we will be able to cover all gaps, answer all questions, and we will convince even the more difficult to convince that the benefits will outweigh the shortcomings. You answered rather wisely and moderately because it was a bit of a trick question. What did you see pique your attention, your interest? Now, this is an evolving system, and you were very good in answering, saying that there is a prospect, there is an optimism that you alluded to, and I agree. Reluctant steps in the right direction. Now, let's give the floor to private insurance, who will explain how this sector views this infiltration or penetration in the national health system.
Good afternoon. I would like to thank the organizers. Health expenditure increase 60% in the public sector and 40% incurred by the private sector. This is a huge percentage, the biggest percentage in the European Union. But actually, the biggest part is private, out-of-pocket expense, and a very small part is private insurance policies, that is. We see at the European level that the demand for private insurance further increases, constantly increases, and the main reason is because now the weight of pensions and other expenditure having to do with defense burdens and is to the detriment to health expenditure. And we see in all national budgets health services curtailing. At the same time, the Hellenic national health system has two characteristics for both, which is hospital-centered and fragmented. This is not a sustainable model for the future, so we must find a way for the day after to develop more first-degree care, because the longer we live, the more we see chronic diseases extended. Chronic diseases do not need big hospitals. There can be excellent management in the primary and out-of-hospital care, as it also happens with the one-day operations. 70% of the programmed operations take place in one single day. That is, the patient enters in the morning, leaves at the evening, and thus we've got better results and lower cost. From the quality viewpoint, it's far better, with far less infections in hospital. Should I ask perhaps that the notion out-of-pocket is not well known? It's private expenditure covered by the patient. It's not bribes. It's the reimbursement, the disbursement, and so forth. And this is, of course, something paid out of the family budgets. But it is an important figure. It's a huge figure. Furthermore, health cost is a huge issue, not only in Greece, but everywhere. We see, generally speaking, and we can see it also in the USA, that health expenditure in the USA is 17% of the GDP. In Europe, the European Union is 12%, and increases 1 to 2 units above the annual inflation. There are many factors leading to this increase: population aging, as well as new technologies, new treatments, all that together contractively, but all this causes major challenges for the social security funds, for insurance companies, the national health system, and the patient, of course. It is a major challenge. It also limits the capacity of the average citizen to buy private insurance, and in Greece this is far more intense, because we do have data where we see that the hospitalization cost in the private sector, especially in Attica, for a bladder removal, for instance, is at the same level with the cost in Switzerland. Of course, this is not normal. It's irrational. There are many reasons causing that. To my view, this is due to the fact that there is a legal framework that limits and curtails the right couple of demand and supply. This, along with other parameters, raises a hurdle in the penetration of private insurance. So, looking ahead, I believe that there is a great margin for cooperation of the public and private sector. The public system has tremendous physicians, has the full equipment. The reason why people avoid public hospitals is because of the long queues and the waiting time. So we must find a way to cooperate in order to have the private sector investing along with the public sector in various schemes of public-private partnerships, so as to strike a better balance between demand and supply, both in funding and the services rendered.
Thank you very much for this, and let's continue with repeating the same question to the other speakers, if they would like to add their experience. I would like to bring an example from another country. If someone wants to use the digital platform to find a doctor, they are forced to declare if they receive social security or private insurance. In case they are neither, they cannot find a doctor. So keep that in mind, because it is a case of exclusion of the patient from the freedom of choice of doctor in the field of off-state system services. I would kindly ask the next speaker to answer the general question: how do you see the negotiations between offer and supply, demand and supply, to find positions, slots in the public system of private insurance? Now, on behalf of the Greek Patients Association, we are clearly on the part of demand, and it has already been a priority and acknowledgement of the need in the discussion we have within the association. I should like to focus on two things that were already mentioned by Mr. Efstathopoulos and Veliotis. On the one hand, we have the given that in Greece we have the highest out-of-pocket expenditure maybe in the world. This can be interpreted in two distinct ways. One is that some people are obliged and pushed towards it because they have a difficulty to access services, and besides, this is reflected in the way that in the OECD we have the highest or the second highest recording of unmet needs. But on the other hand, in a survey commissioned by the Greek Patients Association by Mr. Suliotis, a big part of this private insurance was the will of the citizen. So we know that we have this contradiction in terms, this oxymoron. On the one hand, having those who find it very difficult to obtain access, but on the other hand, a great many citizens want to have access when they want it. Okay, and this is something we know, the Minister mentioned it in the morning, that we have a conundrum. On the one hand, we have a system in which you have easy access to any doctor you may want, both in theory and in practice, especially if we compare it to other healthcare systems abroad, where these things make it very difficult to access doctors. And then on the other hand, it's the question of how to cover these expenses. So there is the will on behalf of the patients themselves, the citizens themselves. The other thing that Mr. Efstathopoulos said, that as of late there's been a great debate surrounding the public character of all such services and the ones that are being reimbursed by the OP, all these services. And in fact, the Patients Association today, we claim universal access for all patients to all publicly rendered services, reimbursed ones I mean, but on the other hand we agreed that public offer does not mean that everything needs to go through the state. The private sector can offer services and be reimbursed by the AOP. So this flexibility, as it were, and collaboration of doctors of both public and private systems is excellent. So private clinics are covered and are augmented by AOP, always contributes even if you do have private insurance or just social security as a private citizen. Another thing that was of concern is that in the past we had some other initial contacts with the insurance, health insurance sector. Today we had our first official meeting with Mrs. Papaspirou, General Director of the Greek Insurance Companies Association, to investigate and examine all those issues that are of interest to the Greek Patients Association and to create a roadmap that will lead us to development and growth. Here I should like to say that in the its recent report, the Competition Commission indicated lack of transparency in the charges of private clinics, and the Consumers Ombudsman in our annual conference said that the citizens who address private providers of health have problems such as lacking information, recognition, vague contract terms, not sufficient coverage from the insurance companies, and overcharging. So one of the issues we want to investigate as the Greek Patients Association is all those elements that will contribute to the building of faith, of trust on behalf of the citizens and the insured parties, to the supplemental part that can be played by private insurance, so as to have a healthy and clear landscape that will be the choice of the citizen and the choice of the patient, because the request or the demand or the claim of the association regarding the needs and the minimum coverage is a universal one. Okay, and this needs to be secured and ensured by the public coverage, public health coverage. So it's a field in which we want to have a collaboration, we want to have an understanding, so that all those regulatory authorities that can play a role to do that in a way that can lead to a clear landscape. I would just like to bring an example that there is still a way to go. So I'm from the sector of HIV. Patients who live with HIV all over Europe have very easy and clear-cut coverage on behalf of private insurance. There are some rules established there that apply. Now, you might make some assumptions. In France, the burden of proof for a premium on someone with an underlying disease is with the insurance company rather than the candidate for insurance. And then the regulatory authority said that there is no reason for premium in seropositive patients. You must insure them. In Greece, it's exactly the opposite. Seropositive patients are not insured, and this is something that we haven't investigated, and we, as the Greek Patients Association or the Greek seropositive patients of Greece, have part of the responsibility, and we need to clear this landscape. So the Greek Patients Association wants a dialogue with the society, with the regulatory authorities, the insurance companies, so as to make things clear in the way that is beneficial to all. Right, so far there is an identification, there is an overlap there in what we want to do in order to clarify whether we're in the private or the public sector, to clarify some shortcomings that we have inherited from the past. Now let's give the floor to Mr. Papadimitriou, who is the CEO of Imithea Group.
Good evening. Thank you for the invitation. I'm the bad guy in this panel, actually. Yeah, because I'm from the side of the private providers. Actually, we've heard about PPPs and the way that this can be affected. I consider that both the part of health and insurance in Greece, it must act in complementarity between the private and public sector. They can both operate in complementarity in a system which has particularities. Actually, there are some special characteristics for a very long time now, and lately, perhaps post the crisis, things have started turning back to normal, but still we've got a long way to go. Insurance is the moving power because it sets the pace on what will be paid, what is covered, what will be reimbursed, what is the data collected. All that, all those things are interconnected and lead to the exploitation of certain levers, which, if used appropriately, then we will do away with phenomena such as the one mentioned, that is, a blood operation have the same price as in Switzerland. I believe this is the exception. It can't be the rule. Anyway, if we have a proper design of the offer an appropriate concentration of risks, insurance risks. We know what we want to cover and where, and introduce the respective audit and control and offer the appropriate incentives to the market. Then we may have both a cost curtailing but also more effective health. What I would like to stress is that due both to population aging and, as it was said, that by 2030, 25% of Greek population will be above the age of 65, this creates a need for more costly and more health services. Given the new technology, you realize that there's a great exacerbation of the cost, so we should view how this whole product, private and public health service, how it can be covered and how it is provided. We spoke of DRGs. We have been using DRGs in Europe for years, in the USA. In Greece, however, originally there was an excellent effort to apply DRGs. Originally, it was called closed single hospital expenses. Then they were qualified as Greek ones. And at the end of the day, now they have evolved on the rationale whatever the AOP can pay, it pays, and the services offered must be universal from all the private providers. DRGs is the right solution. They would definitely rationalize the field, both in the private and especially in the public sphere, which currently has a dual funding system. It is being financed both by taxation and social security funds, whatever that entails for the public insurance system. But on the other hand, we also have private insurance, which in Greece, because we have no such insurance conscience, for this reason, the rate lags behind. Mr. Veliotis mentioned that 40% of health expenditure in Greece is private or out of pocket. Of that 40%, 90% is out of pocket, as said, and only 10-11% is covered by private insurance policies. In Europe, it's precisely the opposite. It's inverse relation. So there's a huge distance to cover in Greece, but we also have a very limited market, which must be rationalized from the private insurance markets as well. They must plan their products accordingly, allocate the costs correctly, with regard not only the networks, but also the way they buy services, and what should be secured by using best practices would be for the money paid by the citizen, either to the public or the private sector, to really be used mostly for his health and not other kind of practices, be it providers, suppliers, or insurers. Generally speaking, we should see such an ecosystem that we will include, on one hand, patients that will enjoy those health services, the providers of health services, be it private or public sector, and AOP as a provider of health services and a buyer at the same time, and private insurance companies, because investments have to be made by all, both the public and the private sector. Technology moves ahead in rapid space. We have AI, we have new techniques, very expensive immunotherapies, which must be able, all providers must be able to provide all those kinds of services and not have a lower quality of health services offered due to the cost. I see. Thank you for the answers in the first round of questions. And now I bring the example of many countries abroad which started from a clash of doctors, providers, and so forth, and through negotiation and collective bargaining on an annual basis, they manage to find a common ground so as not to have an excessive health services cost, nor have a downgrading of quality. Do you believe that we have the maturity level that we attained in the labor relations? Do you believe with such kinds of negotiation on a consensual basis and the support of the state, do you think that we might be able to cover any deficiencies identified? Or is it totally alien to our habits and mentality? Madam Karasiotou.
No, I don't consider it alien or foreign or something that does not concern us. In the last few years, I have seen that there is true and direct and honest discussion among all stakeholders. Okay? And here we're talking about a tripartite or a quadripartite relationship. We have the patients, the providers, the state, the Ministry of Health, the Ministry of Finance, with a distinct role because, well, I will say that we're even more evil than the private providers, because whenever everyone says they're in agreement, we go in and say, no, you're not. But we've taken very serious steps forward, and I would like to say that indeed private social security and private insurance are complemental to one another. And I would like to raise at the 11th hour the idea of disposable income. We need to have an increase in disposable income for the citizens to be able to start developing a culture of private insurance in our country. Is this lacking? Yes, it's not as developed. Therein lies a deficit, rather than the willingness to discuss among the stakeholders. Private insurance has just started entering the mindset and the mentality of Greek citizens. Disposable income does play a huge role, and I want to talk about the reductions of social security contributions that have been achieved over the past few years and the impending reduction of tax rates. As of the 1st of January 2026, this reduction will bring about a significantly important, it will not just go to private insurance, of course, but we're talking here about a policy to increase the citizens' disposable income that may be channeled, under the terms of market, towards this sector as well. And lastly, I would like to say that in reality, a significant part of health care coverage will be very difficult to transfer to private insurance. When we're talking about very expensive treatments or people who have gene issues, we're not talking about a disease or a condition that you'll have and that you started your insurance at the age of 20, and when you're 60 you will fall ill with something and you have a contract and private insurance will cover you. It's much more difficult, I think, when we're talking about congenital conditions that start from early childhood or infant stage, very expensive treatments. Therein we mostly all go to the public social security system, and there the state as a buyer, as a purchaser, not necessarily as a provider, as a buyer of services, comes in to fill in the gaps that need be covered. Would someone want to say anything about how it is fertile ground in our country to do that? Well, we were the good Samaritans. We open our big embrace and embrace everyone, and we are the public hospitals. So if we agree that we share a common goal, social security and private insurance, private and public hospitals, which is what? It is to render the optimal health services. Cost effective as well? Yes, cost effective. And secondarily, since we agree that the myth of privatization of the NHS has been debunked, which it has, the path is clear to discuss all issues that pertain us and our interlocutors raised. This is why we need negotiation and consensus. Would you like to add something? Now, I feel that the future must be one of collaboration, of shared visions, of trust, faith, and appropriate communication. That's beautiful. Mr. Dedes? Just like we said, I believe that we all agreed on this, is that we need to sit around the same table and see in what way we can increase the trust, the faith of citizens to this in this balance, which is rather new between the private and the public sector in private insurance and the provision of services. So we are positive. I agree to the last word with Mr. Dedes. The private sector needs to be there, it needs to be trustworthy. And on the one hand, we have the public sector in terms of social security, just like AOP, who must be transformed to an actual buyer or purchaser of health services to buy what they need at the cost that they consider they should be buying it, rather than on a specific budget that creates ripples in the market when some things are cut. On the other hand, we must have private insurance that must work complementarily to public providers who must have really high-quality health services to offer. After thanking the panel, I would like to voice a wish not to need any clash or pressures to have this dialogue on health-related issues. Since we have all this willingness to resolve the problem from all sides, and where we find a hurdle is the technical difficulties, I think that there should be no sort of pressure to lead us to the best possible results with a timeless duration. It's not something temporary, because health is not very prone to changes and very fast. Thank you very much. We would like to thank the AmCham again for giving us the opportunity to raise another issue for debate. And this issue apparently leads to an interesting consensus that was not self-understood in all panels. Thank you very much. Have a great evening.